Professor Manmohan Singh, my cabinet colleagues, Dr. Ramdas and Kapil Sibbalji, Minister of State, Srimati Lakshmiji, Health Secretary Shri Hoda, Mr. Rajat Gupta, Dr. Fleming, Dr. Reddy, distinguished ladies and gentlemen. It gives me great happiness to be with you at the birth of the Public Health Foundation of India. I commend all those who have worked with passion and commitment to create this foundation. I wish you every success in this endeavor to galvanize public health in India and to guide policy in the critical area of social development. The importance of public health in India's development cannot be overemphasized. Ours is a demographically young country. The largest growing demographic segment in India over the next 2 decades lies between 15 and 59 years. This provides a wide window of opportunity to enhance national growth, provided we can productively deploy this vast human resource. However, this requires adequate investment in education and health, the two vital areas of human resource development to which my friend Amartya Sen has so vigorously drawn our attention over the years. If we do not effectively upscale knowledge and skills of our people and act purposefully to protect and promote their health, we run the great risk of wasting this precious human resource. Good health is not merely a development resource, it is an inalienable human right of every citizen of this country. Every Indian has the right to demand and obtain essential preventive, promotive, diagnostic, and curative health services. It is the bounden duty of the Indian state as well as society at large to ensure that this right is fully respected and adequately realized. The management of health has overly focused hitherto on clinical management of diseases and has ignored the larger social and economic context in which health is best managed. It has been aptly said that the conventional understanding of malaria is that it is caused by a mosquito. But if you widen the lens and ask what facilitates the mosquito, the answer may be that we are living in an environmentally degraded space. Any further analysis would reveal that this in turn may be the result of economic causes. Therefore, health issues need to be conceptualized in a framework that understands these relationships, even though a specific disease itself can be treated through a mixture of social and clinical management. Issues of health, particularly in developing countries, have strong links with social, economic, environmental, and cultural factors. They therefore need responses that appreciate intersecting spaces. It is this understanding of the intersecting spaces within which health policy needs to be located that the initiative of the Public Health Foundation of India has posed before us. It seeks to bridge a very major gap in our health education by training professionals in disciplines that relate to health, such as economics, sociology, demography, and environment, in addition to the management of disease. We need to develop a new cadre of professionals who are managers of health and not just of diseases. We have good quality human resources in the area of clinical management, but we woefully lack public health managers. I therefore commend the Public Health Foundation of India in taking this initiative to bridge a critical gap in health education and in blazing a trail by setting up a series of public health schools. From what I see, we face a major gap in human resources in health. We have recently asked the Planning Commission to make an assessment of the scenario of human resources for health. This is important to address the wide inequalities in the provision of services within India. While states like Kerala, Tamil Nadu, and Gujarat may have acceptable standards, there are several states in the country which do not have even the minimum number of institutions to turn out support staff for their health care. There are also serious lacunae in the capacity of the health sector to absorb and optimally utilize extra financial resources. This gap must be filled, must be bridged to ensure effective delivery of programs. Programs for the poor will degenerate into poor programs if these deficiencies are not corrected in time. We must also address the capacity gap among health professionals. The skewed distribution of specializations among our doctors is also a concern. There is a severe shortage of trained public health professionals with broad-based multidisciplinary knowledge of the determinants of health. Such deficiencies are more acute within our public health service sector, and this generates a more severe impact than deficiencies in clinical medicine. They complicate the task of managing public health programs. Such lacunae also impose an additional burden on medical doctors who are trained primarily as clinical care providers. All of these problems have resulted in the suboptimal performance of major health programs. We need, therefore, public health professionals equipped with expertise and managerial skills to design and deliver health programs at the national level and down to the village level. We must also provide relevant training to enhance the capabilities of healthcare providers involved in public health activities. Apart from these lacunae, there is also the realm of future opportunities. India faces the possibility of becoming a global destination for cheap and high-quality health care. The demographic contrast between a young India and an aging world gives us an opportunity to train professionals at different levels to meet the needs of the emerging global care industry. These issues have not come on the policy radar because of the absence of institutes like public health school, which would have tracked such issues. Our government is sensitive to these issues. Quite apart from an unprecedented increase in budgetary allocations, we have tried to make architectural corrections in our programs to see health in a holistic framework through the National Rural Health Mission. The mission will not only seek to reduce inequities in health in rural areas, it is also designed to greatly improve access to essential health services and to enhance citizens' control over healthcare planning. We are trying to move away from